Nurses Leading Change, What You Need to Know for Board Service. I'm Karen McDonald, a longtime nursing leader in the community, and I've been helping to advance the efforts in Minnesota to lead and advance nurses on board service. In other sessions in this series, we set the stage for why it's important for nurses to be on boards to help lead change and advance health. Nurses bring a very unique perspective along with extensive knowledge and skills to the boardroom table. Today, you're going to learn from 3 nurse leaders in Minnesota as they share their experiences on boards. And they will share with you how they got started, some of the key competencies that they've found successful in their success on boards, and how they are currently helping to advance the nursing presence on boards in the Minnesota communities. I'm very pleased to introduce our panelists. We have Judy Pekacik. Judy is a clinical professor and program director of the Doctorate of Nursing Practice program at the University of Minnesota School of Nursing. We also have Dan Pessett, who is professor of nursing and director of the Katherine J. Densford Center for Nursing Leadership at the University of Minnesota as well. And Jenny Prochnow, who is an assistant professor and co-coordinator of the Nursing and Organizational Leadership program at Winona State University. So welcome, Judy, Dan, and Jenny. So I'm going to facilitate and get us started here with some questions. And first of all, Judy, why don't you share with us in your experience on boards, how you got started in board service?
Thanks, Karen. Again, I'm Judy Pekacik, and I got started in boards a number of years ago when I was asked to participate in a project related to healthy work environment. Folks that I was working with were involved in this, and they asked me to participate. So I was pretty much just asked. And Dan, why don't you share your board experience? How did you get started?
Thank you, Judy. I'm Dan Pessett, and I got started. There are a couple of ways you get started in board service. I think one is by position. Sometimes, actually, because of the position you have in an organization, you are automatically a member of a particular board, and the other is really by interest. And so I was on many boards in South Carolina when I was the director of the nursing service at the Hall Psychiatric Institute, and that got me connected with the South Carolina Hospital Association, the South Carolina Nursing Recruitment Retention Organization, and the South Carolina Organization of Nurse Executives, and that was really by my position. But my interest has always been in scholarship, and I became very involved in creating chapters of the Honor Society of Nursing Sigma Theta Tau International in my undergraduate program, and that's been a significant part of my career, and served on the board of directors of the International Honor Society, and actually as their president from 2003 to 2005 for an 8-year period. And that was more, I think, by interest as well as position.
And I'll add my experiences as well. So when I first got my bachelor's degree in nursing, I was on my Dakota County website looking at some parks and recreation information for a class that I wanted to take. And on there, it said that they were looking for board members for the Parks and Recreation. Well, I looked into that, and it said that I could contact my county commissioner and send in my resume, and I would be eligible, hopefully, then for board service. So I did that. I contacted my county commissioner. I emailed her my resume, and immediately she got back to me and said, "We'll be happy to take you. In fact, we have an opening on the Health and Human Services Board. Would you be willing to serve on that board?" And I jumped right in. I really didn't have any training. I was a new nurse, but I knew that I could bring something to my community with my degree. So that's how I got started.
Great. Well, thank you very much for sharing how you got started in board service. And as you can see, there are a lot of different ways in which nurses can get involved and get started. So one of the things that I think would be helpful for nurses to learn a little bit more about is what you found were some of the key competencies that really helped you be successful in the various boards that you've been members of. And Jen, why don't we start with you?
Sure. I would say the first key competency, and I'm not sure if it even is a competency, but to have passion for what you're serving and doing in. So my passion was for my community, for the people in my county, for the people in my city. And I really thought that as a nurse, I had certain skills, especially relationship skills. I think nurses bring those skills to a board, building relationships, establishing trust as the most trusted profession in nursing. And I heard this quote at a conference where the lady said, you know, the most trusted should be our trustees. And so I really liked that quote. I think that it describes us as nurses and what we bring to board service. Another one I think is strategic leadership. So understanding what is the mission, the vision, what are the goals of the organization that you're serving for on a board, and making sure that the activities of the board are really aligned with those mission and visions and strategic goals. So I think strategic thinking is a big one. I think another one that I learned over time, I didn't know right away, but I've learned over time, is the fiduciary kinds of business skills. So making sure that you understand how to read a balance sheet or an income statement. And, you know, these may be big numbers, but remember you've all done your own budgets at home. And so those skills can transfer over, and just understanding where the money's coming from and where it's going is what it's all about.
Great. How about you, Dan?
Well, I'll build on the P word, passion, but I'm going to use the word perspective taking. I think one of the greatest contributions a person can make to a board is to keep the board always aware of the different perspectives in relationship to the organization. So you have the perspective of the board, you have the perspective of the mission of the organization, but you also might have to periodically ask, what does this position or stance mean for the membership? How would people on the outside of the board take a look at this? Are we doing things perspective-wise in terms of present, here and now kind of reactionary sorts of things, or do we have the long-term future in mind? And so you have to be able to sort of challenge the board, as well as maybe yourself, to think about multi-frame thinking and multimodal thinking in terms of perspective taking over time, over situations, emotions, facts, feelings, and so I would build on passion and say it's really about perspectives and the kind of perspectives that you can bring. And the other thing I would add is it's about making connections where maybe other people don't think about connections. And sort of, I used to consider myself sort of a bumblebee. I would cross-pollinate on board saying, well, they're doing this over here. How will that relate to our situation here? And so that sector boundary spanning too is an important, but that's a matter of perspective.
Wonderful. And Judy?
Well, I agree with what's been said. I would add that a deep curiosity and a desire to make things better. So when you're curious and that you want to serve and make things better, you kind of naturally try to use different processes to make those improvements and to be non-judgmental about possibly how things have been happening in the past, but knowing that you want to make things better, and so asking questions, knowing who's that ultimate customer to the service of this board, keeping them front and center, and then being accountable. So being on a board has some effort with it, so you need to prepare yourself for those board meetings, read your packets. If you are going to establish relationships and do things outside of the board meetings, do those things. It's a service responsibility not to be taken lightly, so being accountable and responsible are some really good behaviors and or competencies that successful board members, I think, have.
Great. So in our previous, I'm going to just move into the camera here a little bit, but in our previous sessions, we did share quite a bit on how you can learn more about getting started in board service and how you can continue learning to be a great board member. So there's lots of resources out there. In a minute, as we address our final question, we'll share some of those resources. But I wanted to acknowledge that there are a lot of resources out there, and you've heard some great information from Dan, Judy, and Jenny today, but we encourage you to continue learning more as you are on your board service journey. So let's address one final question and have each of you share a little bit about what you're doing in the nursing community in Minnesota and nationally as well to help advance the efforts to get nurses on boards. So
Dan,
maybe-
why don't you start this time?
All right. So the Katherine Densford International Center for Nursing Leadership has many, many programs to educate people about transformational leadership capacity, creativity, wisdom, and policy issues in the world of board leadership. I also work at the national level with the International Honor Society of Nursing Sigma Theta Tau International, and they generally offer an annual board leadership development program, which is a 2-day learning opportunity, and they bring in people from all around the country to talk about some of the skills that we've talked about here, as well as to help people get placed on boards in the Honor Society. They have something called the Volunteer Interest Profile, which enables people to match their passion with the need in that particular organization.
Great, thank you. Well, a couple of my activities as a member of Minnesota Organization of Leaders in Nursing and the past chair of the Policy and Advocacy Committee, every year we would hold an internship where we invite student nurses and nurses to come and learn about being a nurse leader in advocacy and really leveraging your voice of advocacy. And being on a board is leveraging that voice. And so we talk about board service as well as other governance topics at this internship. So that's one way that I participate in the space by educating our current nurses and future nurses. Also, as a faculty member, really talking about board service in all of my classes and all of our different levels and programs at the University of Minnesota School of Nursing. And then personally, I do host new folks, new to boards. In all of my board meetings, I try to bring somebody who is new and interested in serving as a board so they actually can see how it works. I also spend time with student nurses from other academic settings about how they can be engaged and participate. But I think it's nice to do board service with someone else that can help pave the way for you. So I think that's one way I can be a mentor to someone who is new to this and wants to learn more. So I'd put that offer out there. If you're interested and want to attend a board meeting with me, you can find me at the School of Nursing. So Jenny, how about you?
So I've had the opportunity as well to serve on the Minnesota Organization of Leaders in Nursing and participating in efforts like these, creating videos and providing information to nurses who are interested in serving on boards. I have also taken on the responsibility of being the Minnesota co-lead, I guess, for the Nurses on Board Coalition. So we are receiving a lot of national data, and we're finding ways here in Minnesota to help get the information out to nurses who are interested in serving on boards, what they can do to either get started or how they can find opportunities to serve on boards. And so those are some of the opportunities I've had, as well as Judy said, really bringing in my students in my classrooms. I do present information on nurses serving on boards. I tell my story about how I got started and how really easy the process can be to start serving on boards. So that's been some of my activities.
Great. Well, thank you so much, Judy, Dan, and Jen, for sharing your words of wisdom about your experiences in board service and how one can get started on their journey. And we particularly encourage you out there in the nursing community to get involved. And if you haven't taken that first step, to take that first step and at least check out the resources and put a step forward to get involved. And hope that you find this information helpful to you on your continued journey. So thank you very much for joining us today.